So my name is Sanjay Agrawal. I'm a doctor. I'm an intensive care and respiratory consultant at the University Hospitals of Leicester. Yeah, so I think it's really interesting. NHS finance has been evolving over the length of the NHS really, and it's going to keep on changing. And so it's really interesting to think about how things may develop going forward. And NHS finance, like everybody else, is going to be affected by, artificial intelligence, robotics, and it's going to hopefully open up a whole new area where perhaps some of the back office functions can be automated and don't need as much time from humans as is currently the case. And actually, finance professionals can actually take on other roles, which I would say are much more important and uses their professional skills much more effectively. So what I mean by that is things like finance business partnering, where finance staff are much more visible. They're out there with clinicians, maybe on ward rounds, at the coalface with frontline clinicians, actually talking about patient pathways and how to get the best value from those pathways. Whereas at the moment, it's possible that they're probably taken up with a lot of time doing end of month accounts and things like that. Hopefully some of that time will be freed up so that they can be much more visible and do their finance business partnering role. And what I'd really like to see is a clinical finance business partnering role where the finance team train clinicians to look at value and look at whole pathways and work out how we can get the best possible quality but make it sustainable and timely. So I would like to see current finance staff training clinicians in understanding some of the basics around finance so that they can then apply it to clinical pathways. So that's what so I think it's great. I think it should free up time and we can use the finance function much more effectively. I mean, one of the things that strikes me is that finance professionals who often end up becoming chief executives and really responsible and drive the culture of an organization. And so there's this whole succession planning, and we need to hopefully encourage and take on more people who want to do NHS finance and give them the leadership skills and work with clinicians to hopefully get the best on patient pathways. That really starts in every single organisation. So every CCG, every hospital, every ambulance trust, they could be doing this right now. So all of them have finance business partners, I would hope. But they should, I would hope that they could sort of encourage more and more of their finance staff to take on that role. But what's key is how you define it. And so I know the HFMA, I think, are producing something this month around finance business partners and what their role is and how to make the best use of that role. And I would like to see that really taken up so that in terms of practical steps is what you asked me, we should be doing that now. And so identifying who in your team can become a finance business partner, how many people you can do that with, what the role is going to be for that person, using these sort of national standards, if you like. And then the sort of finance business partners should train a group of clinicians to become clinical finance business partners. And that way you upskill the clinical workforce. Most clinicians know nothing about finance and how it affects patient pathways and how to get the best out of it. So I think actually this can be done now. So in fact, in my hospital now, we're training a number of clinicians. In our trust, they're called coding and costing leads, but the principle is the same. We're training them to understand much more about finance so that they can look at PLICs and other financial information and then apply it to clinical pathways. So I think that's the way forward. The other thing I think that finance, I would hope professionals could do going forward is we know that we need much more integration between primary and secondary care. And how do we do that? How do we pay for, say, secondary care clinical staff to help upskill specialist areas of primary care? So for instance, respiratory medicine, how do you get more education to primary care about respiratory patients to avoid hospital admission, to use medications better to improve quality of life? And I think the finance team have got a really important role in moving money around the system to follow the patient rather than money being assigned to organisations. If there was an easy answer to that, I'm guessing it would have been sorted out by now. But I think finance professionals of the future are going to have to work cross-boundary between primary and secondary care, maybe across other public organisations like local government, like councils and others, so that we also think about the social determinants of health, like housing, heating, those sort of things that impact people's lives that then make them seek medical attention.